Hello everyone, my name is Dr. Iskander. I'm a general surgeon at Georgetown in Ontario, Canada. I'm here to present to you a different concept for the COVID intubation box. We made some changes for this box here in Georgetown, and we're going to call it now the Georgetown Protective Intubation Box. First of all, before I start into the box itself, I would like to thank everybody who have contributed in the fight against this disease. A lot of people donated money, volunteered their precious time, and some of you also came with ideas to help improve the outcome of the fight. The original idea of a COVID intubation protective box came from Taiwan. A Taiwanese anesthetist by the name of Dr. Lai Shan Yang. He made this box to protect the doctor and act as a shield between the doctor and the patient who may have this disease. A group of very good people here in Ontario came together. They manufactured similar box and distributed freely to a lot of hospitals, and I personally thank them sincerely. In Georgetown, we got few of these boxes. I have some concerns about them, and that's why we came up with different ideas to improve the functionality and to make the box more protective and more ergonomic. Okay, so I'm just going to go over some of the changes and describe the new box. So first of all, this is the box. I hope you can see it. It's a little bit difficult, but so the first change we made is this is the front sheet. We made it at a 60-degree angle, and this will give the operator the chance of having a forward view as well as an aerial view that will help during intubation. The second thing I made is we added a third hole here for the nurse to help during intubation, and we put also the two holes for the arms of the anesthetist or the doctor who does the intubation at a little bit discrepancy. The left one at maybe 1.5 inches or so above the right one. I added a third hole in the front sheet for the breathing tube. So the head of the patient is here. After intubation, the breathing tube will come from the ventilator through here into the patient. I also added some rims here, grooves. So I added some two wheels to create a groove here, and I'll explain to you in a second. Just I wanted you to have a look at this to understand. So one of the main concerns I had with the boxes provided to us is the holes where you put your hand in. So the idea is you put your hand in, you do the intubation. When you take their hand off, these holes are open, and actually the movement of the hand can create a current of air that if there is viruses here, they may come to you. So that's why we came up with these rims here, and with the idea to attach gloves like this. These are veterinary type of gloves. They're large, and I'm going to put them through the hole, fix them on the outside with a rubber band like this, and this will give us a complete seal of the opening here. So now it's completely sealed. When the anesthetist or the doctor put his hand inside the box, it's protected. It's not contaminated. and when they take their hand out, there is no air coming out. So put a glove like this here, another glove here, and a third glove for the nurse in the opening that we made on the side. The addition of this third hole helped a lot after trying this. In the intubation, it will be 3 hands helping in the intubation. We also do the same here, the same glove we do it for this, to again cover the intubation tube and to keep the system sealed. So first of all, we're going to put a sheet of plastic like this on the pillow, and this will give us the purpose is to create a complete seal inside this structure. And I have my gloves ready. These are veterinary gloves that they use for animals for different purposes. And so attach one here, and a third one in the arm, the nurse side, and we'll attach one here for the intubation, for the tube, the breathing tube. So now we're ready for the intubation. We've got the gloves here attached, the 3 gloves attached to the 3 holes. The nurse is sitting there. And also I'm going to attach the breathing tubes from the ventilator to the patient, and they'll pass here and will be ready. And the anesthetist should put everything inside, the gyroscope, the suction, everything is inside the box before we completely seal it. And once we're ready, everything is ready, we just make sure to seal the whole structure completely. Tuck these drapes under the shoulder here, and I'll go from the other side. Okay, make sure it's completely sealed. I also keep the suction going on throughout the procedure to create a negative pressure within the structure. If there is any leak or any area that's not sealed completely, air will go inside the box rather than outside the box, and then will be suctioned with the general vacuum of the hospital. And that's it. So thank you very much for watching this presentation. I hope it's informative, and I would like to thank everybody of you doing your job during this very difficult time. Thank you.